Who produces?
You are live.
I think so.
2.4.
And even if we can't do it all, you know.
These Skittles are jumping around. Like
September.
Thank you.
And it's nice to see everybody in person, get used to the YouTube thing, so this is nice. All right, so the first thing is to approve the minutes of last month's meeting. Supervisor Conover, seconded by Supervisor McDevitt. Any additions or corrections to the minutes? If not, then we'll vote. All those in favor?
Aye.
Aye. Opposed? Carried. Thank you. And with that, Rob, I will turn it over to you.
Okay, good morning, everyone.
Morning.
Let's see, first thing that I have on the agenda is a resolution request to amend the 2022 Warren County budget in the amount of $10,318. This is additional state aid that's been received, designated for 2 contract agencies. It references a Schedule A there, but I really just put them both on the resolution request form number 7. It's for People Incorporated and for the Association for Mental Health. And the amounts are broken down there. It shows the breakdown between the 2 agencies.
All right, would someone like to make the motion? Supervisor Conover, seconded by Supervisor McDevitt. Any discussion? All right, all those in favor? Aye. Opposed? Carried. Thank you.
Okay, the next request is a resolution request to amend the 2022 Warren County budget in the amount of $101,559 to allow for expenditure of opioid settlement funds to address opioid crisis impacts in Warren County. The request is with this funding, if we move this funding over as referred to on, again, resolution request form number 7, the second one, that shows the budget codes. That'll allow for, there were 3 projects that came in under our ARPA funding, the 1 million set aside. There were 3 that were related to addiction services that fit well under the opioid settlement guidelines. Since our total ask for the ARPA funds was over the 1 million, we thought, well, if we could pull these 3 out, that would, help.
Right.
And it made sense to go ahead and try to move these over to the opioid settlement funds. So I don't know if you want me to go ahead and talk about the projects or.
Let's bring the motion to the floor, then we'll let him talk about it. Supervisor Beatty makes a motion, a second to that motion. Supervisor McDevitt. We'll turn it back to you, Rob, so you can kind of explain that to us.
Yeah, I mean, the next 3 resolution requests are the actual requests for contracts for those 3 projects. So the first one here that we have the motion on is the budget move of the funds. And then the next 3, the following 3 are the 3 projects, requests for contracts.
All right, let's go back to number 2 then. So we'll vote on that and then we'll move on to each one of those.
Okay.
All those in favor of number 2? Aye. Opposed? Carried. Thank you.
Okay, just moving through each one, then the first one is a request for a new contract. Now, 820 River Street is one of our contractors, but we're doing it as a new contract rather than adding to their existing contract because of the desire to sort of track the opioid settlement funds separately. Rob Lynch recommended that we do separate contracts. So that's the reason for the request. What the project would do, would create a mobile outreach worker who would be able to do treatment out in the community. And so we would like to be able to support that.
All right, someone like to bring that resolution to the floor? Supervisor Beatty, seconded by Supervisor Bramer. Any discussion? Supervisor Beatty.
Thank you, Madam Chairwoman. So this would come out of the opiate money, correct?
Correct.
And so basically all 3 of them are coming out of the opiate money.
Correct.
Okay, so yeah, all right, I'm good.
You good? Okay. All those in favor?
Aye.
Aye. Opposed? Carried. Thank you. Next one, Rob.
Yep, the next project we request the contract for again, and it's an existing contractor. We know them well, Council for Prevention. They would like to reestablish an outreach coordinator at the Hope and Healing Recovery Center. So this is like, peer-led recovery type services. And that would allow them to do more outreach in upper portions or reaches of Warren County.
I'll make that motion.
Thank you Supervisor Burnworth. Second to that, Supervisor Beatty. Any questions? All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
Okay, thank you. The next project was proposed by the Addiction Care Center of Albany. Again, a current contractor for us. What they are proposing to do is develop some family support services and hire a family navigator that can really help families, when they're struggling with a family member who's caught up in addiction.
All right, someone like to bring that resolution to the floor?
I'll make that
Supervisor Bramer, second to that motion, Supervisor McDevitt. Any discussion? All right, Supervisor Beatty.
Thank you, Madam Chairwoman. Should we be, this is funding for it coming out of the opiate money, but can we, this is not just a one-time fund, right? This will be an annual request.
Well, okay, here's a good point, is that these projects will be one time. However, we're spreading them over 2 years. Because there's only so much opioid money that's already been received, like on hand. So what we did is we prorated their budgets for their projects for the balance of this year. And then we're gonna fund the rest of it into next year as
Again, coming out
as
of
the
the opiate.
opioid money comes in.
So there wouldn't be any county responsibility, all for the 2 years coming out of the opiate money.
Yeah.
Okay.
But other than that, so to speak, it's one-time fund. I mean, it's a one-time shot, once they expend their funds, it's not ongoing.
Gotcha.
Supervisor Bramer.
On that note, though, could it be extended if we get more opioid settlement funds? Yes, yeah. So we're not on the hook unless we get more money and want to extend it.
Right.
Yeah.
So after year 2, if we get additional opiate money, we can, there's the need, then we can.
All right, then we'll vote on that resolution. All those in favor? Aye. Opposed? Carried. Thank you.
Okay.
Rob?
Then moving on to our discussion item is just the one item of the 2023 proposed departmental budget. Harry Carlson, our Deputy Director of Fiscal, is with us today, and he's going to review the budget.
Okay, just wanted to point out a couple of changes. Or something notice, we did add peer-to-peer support services, which is funded through or contracted with Sony now. And we anticipate that in 2023, that it'll go back up to the 185 with 1,000, which is originally approved for this project through Senate. Any kind of the increases you see related to the contracts here are all covered by the COLA that was made available this year, effective 4/1, and it just extends the next quarter into 2023. Just want to point that out. One of the things too with you might notice with alcoholism, the care center or the addiction care center is that it is reduced by about 200,000, but that's related because in this year they gave the agency $200,000 related to the development of that new site, the men's residential program. And in 2023, it'll go back down, but we'll probably have to come back because then we have to consider the men's budget also, or the budget for the men's project. As far as our particular budget, the only thing increases we really experienced there was related to the rent and just membership, and that's about 3% for the membership. We also got a little bump in the revenue because of that 5.4 COLA. Still a little unsure about how much we're going to get with these federal salary sharing. They're very unpredictable when they come in. And in the last quarter, we could get another 3 quarters of funding, but right now we've only received 1 quarter. But on average, we usually get about 80,000 a year. And of course, with the salaries and fringes, it's whatever, you know, the treasurer or the office put in. And as far as the medical fees, the psychiatric, we put in 50,000 with the understanding that who knows, you know, what that's going to be. That's basically it. Any increases are pretty much covered by state aid or part of the COLA that is being, and hopefully it'll be annualized next year. And if I take that first quarter, annualize it for the rest of the year.
All right. Any committee member have any questions regarding the budget? We're all good? Okay, thank you kindly.
I do have just something that perhaps we could put on Rob's agenda about discussion for adolescent behavioral health services in the county. It's something that we've heard about through the hospital. I know that Rob's office is working on it. I just want to try to keep it on our radar to see how we can help move that forward as we go forward. Depending on what you guys do with the Community Services Board and the hospital's application there. Coming back to committee with some kind of report about where we are would be really helpful. If you don't mind, Madam Chairwoman, putting that on.
Fine.
Thank you.
If that's good with Rob, that's okay with me. All right, thank you kindly. Have a good afternoon.
Thank you.
Thank you.
All right, we'll move on to Office of the Aging agenda.
Good morning, still morning. The first item on our agenda is permission to transfer funds from Hamilton County contracts to personnel and fringe, and this is to cover associated expenses for doing client assessments in Hamilton County for our home delivered meals clients.
Do we know what kind of funds we're looking at transfer? How much?
It is $42,775.
Okay, thank you. All right, would someone like to make that motion? Supervisor Conover, seconded by Supervisor Geraci. Any questions? All right, we'll vote on that. All those in favor? Aye. Opposed? Carried. Thank you.
Item number 2 is permission to fill the meal site cook number 4 position at our Cedars meal site due to termination. This is effective September 6th. And then to backfill any positions that may be created due to this. This is a grade 2, 35 hours a week. It is approximately $31,000 and the starting rate is $17.04 an hour.
All right, would someone like to bring that motion to the floor? Supervisor McDevitt, seconded by Supervisor Geraci. Any questions? All right, all those in favor? Aye. Opposed? Carried.
Item number 3 is permission to enter into a business associate agreement with the St. Lawrence County Health Initiative. Basically, they make referrals to us and through our New York Connects program. There's no monies exchanged with this agreement. It's just mainly to cover privacy information for client information.
I'd like to make that motion. Supervisor Conover, seconded by Supervisor Geraci. Any questions? All right, all those in favor? Aye. Opposed? Carried. Thank you.
And the last action item is to enter into a contract with BPI Mechanical for repairs to refrigeration and freezer units and ice machines and other like equipment at all sites located in Warren County, including the Office for the Aging, the Warren County Jail, Countryside Adult Home, and Department of Public Works. The rates are included. This agreement starts on January 1st. This was not done earlier because we thought it was included in another contract that the Department of Public Works had, but we discovered that it was not included in it. And we do have the option in here to renew for 5 years, 5 additional 1-year agreements if there's no material changes.
All right, someone like to make that motion. Supervisor Conover, seconded by Supervisor McDevitt. Any discussion? Supervisor Bramer.
I did think this was interesting that it's coming up through your department. Are you going to be managing this contract then for the
Yes.
whole county
Yes.
and all these? Okay.
Mhm.
I
Yeah,
just thought it would
and
be
we
considered
have-
some of the Public Works thing that they should be doing.
Yes, we were the ones that brought it up previously. For some reason, it was listed underneath Countryside Adult Home, but we brought it up the last time. But we are the ones managing it, yes.
Any other questions? All right, all those in favor? Aye. Opposed? Carried. Thank you. We're going on to the budget, I think.
So then you have my budget. Are there any questions on that?
I just have a general question, just in terms of the aging population in Warren County. Based on your experience over the years, is there any compelling need that we're not addressing in Warren County? Is there just something that we're not doing that we should be doing? It's kind of a hardball question. It just
One of the major things, and it's across the state, is transportation. That's a major need for the seniors. We do have contracts with several of the towns to provide social transportation. And then we do medical transportation through our office that's done through volunteers. We also have a contract with RSVP now, which we did this year to help with the medical transportation piece. And then there's other entities within the counties, both Warren and Hamilton, that do transportation. But that is something that is a need. And throughout the state, there's, this NYSOFA, the New York State Office for the Aging, is trying to come up with various ways to address that. But there's nothing that's been developed. And it's something that's hard to tackle because we don't have a fleet of vehicles. We don't have staff to provide the transportation because it would be a huge cost. And I don't even know if we'd be able to get the staff to do it, to cover it all. But that is something that would be a huge need, I would say, one of the huge areas across the state.
Anyone else have a question regarding Supervisor Bramer?
I mean, with a lot of these department heads, I understand, or department budgets, the personnel costs going up because of what we did in August, but so I've been trying to take a closer look at contracting fees, and one, it looks like the Hamilton County consulting fees and something else. Do we get corresponding revenue for them? Like they cover all their costs?
Hamilton County, yes. Hamilton County costs are either covered by contributions from clients. The Hamilton County share from the funding resources we get from NYSOFA, the New York State Office for the Aging, or Hamilton County covers the difference. So all Hamilton County expenses are covered completely. Warren County doesn't cover any of that. And then for Warren County, we have, of course, Warren County contributions from the clients. Warren County share from the different funding programs, the Title 3B, 3Cs, 3D, 3E, ISIP, CSE, CSI, New York Connects, MIPA, HICAP. There's various ones, which I'm just realizing I didn't include that this year, which I normally do, which I can send out to you.
Okay.
It tells you what we get approximately each year from them. And then what the county share is, what our responsibility is, whether it's 25%, 10%, or 0%. And then the county share. Typically for our home delivered meals and our congregate meals program, we contribute way more than what we have to. For the past couple of years, it has been pretty much exactly what we've had to cover because we've had large amounts from stimulus fundings from the CARES Act, FICRA, and then ARPA. One additional funding source that we got this year was called Unmet Needs Funding. The Unmet Needs Funding was something that the New York State Office for the Aging was able to get to address the waiting lists that different programs throughout the state had, like for ISIP, which is the expanding in-home services for the elderly programs, which was the AIDS that they get to provide housekeeping services, personal care services in the home. We've never had waiting services for any of our programs. If a client needed something, we were able to get it to them right away. With the home delivered meals program, the reason why there was no waiting list is because the counties, both Hamilton and Warren, provided it no matter what, even though the county share was way overmatched. So we typically, both Warren and Hamilton County, provided like 75% match as opposed to the 10% that they were supposed to. So that's why the reason our expenses are so high is because you guys have always paid so much, Warren and Hamilton County. But we were able to demonstrate that if we did not have those county matches, the large overmatches, we would have a waiting list. So we were able to get an extra $150,000 this year in unmet needs funding, and we will have that ongoing. And then we found out, I believe it was in the beginning of August, that we actually had that money last year that they never gave to us. And instead of them giving it to another county, I was able to have them give it to us for this year. So some of the funding that we normally get this year, that because of that unmet needs funding, we're going to carry that over till next year. So you'll notice that our federal aid, some of the areas, which is, let me find the exact line for you. Sorry. So on page 2 of 6 in here, you'll see a new line 3787. It says OFA unmet need fundings. You've got the 120,000 for Warren County. That's new.
Wait, 3787 unmet there. Okay, yes. I was
Yep,
looking
right
for
here.
that word.
On page 2 of 6. That's just the Warren County portion. And then you'll also notice
Shouldn't that have a 2022 actual amount of 150?
we have to give some to Hamilton County. We can't take 150,000. We have to give them some.
But it's a zero.
Yes, because we didn't actually have it in our budget for 2022.
Oh, I see.
Because we just realized we got that.
Okay.
So we didn't have it allocated in there. And then you'll notice that 4487 is 138,000, which is still quite a bit. Like a lot of our fundings are still up there quite a bit. Number on page 3 of 6, 4795 is increased 40,000. So we have a lot of additional funding this year and next year because of that unmet needs funding, because we were able to reallocate some of the monies we had this year to next year to reduce our county match for next year for Warren County and for
Supervisor
Hamilton.
Beatty.
Thanks, Madam Chairman. Is the unmet needs fund a one-year gig?
No.
Or is that a continuous?
It's going to be continuous. We don't know for how long, but for right now, it's going to be ongoing. It's depends on how long the federal government decides to give it to the state.
Do you need to do a budget
other
amendment for that,
discussions?
that we got this year?
We
Did
do-
that already happen?
We don't typically do the budget amendments. We just, the money just comes in. I've never done the budget and amendment
Any other discussion or
for the stimulus monies.
Supervisor Bramer, are you good?
Yeah, thank you.
Okay. All right. That's it on the budget. No one else has any other questions? All right, we have one other discussion item. WC 48-22 Warren Hamilton County's Office for the Aging Senior Nutrition Meal Program Supplemental RFP and what's available in the purchasing department. If I'm not mistaken, was this RFP, this was something that was sent out before Ryan left, or was it like in the
Correct.
stages ready to go? Looking for someone who might be interested in helping with the county meals. Is that kind of what it was going out for?
Ryan requested that this be sent out right before he left. It was a result of a request to the ARPA committee, I believe. And it was also based on our previous request to find somebody to assist us with meals back last year when we were having difficulty finding vendors to supply us with meals.
Okay, and the only one we got back was from the Salvation Army, is that correct?
Correct.
Okay, and I noticed that this one point, what you had said to me was only the meals for Glens Falls, Queensbury would come from the Salvation Army instead of Cedars. And they could do the Lake George route that is still receiving mom's meals with the option to expand to other meal sites later on if the county wanted to. It says the Salvation Army would offer the congregate dine-in setting for Glens Falls, Queensbury area as well, instead of at Cedars, which is only open to Cedars residents. Currently, the congregate sites in Glens Falls, Queensbury are closed. So I just thought it was something we should at least discuss to see if there was any interest on the part of committee and having someone that would help us with that. And he does have the major here today. So I know you had a couple of questions before, Mr. McDevitt. So I think this is a good time. If you have questions that you can ask him the questions, or if you have a question for Dee. You want to start, Mr. McDevitt?
Yes, please.
Oh, excuse me.
Further. Listen to the county administrator.
Yeah. My only question is, should we be in executive session when we're discussing this?
Should?
You know,
That was the presentation.
Oh, well,
we don't have an attorney here today, but I would say this is discussing a contract on things and would fit under the 105 Act. So, I would look over to the work there to see if
So if you were going by 1051F, that would be the medical, financial, credit, or employment history of a particular person, corporation, or matters relating to the appointment, employment, promotion, demotion, discipline, suspension, dismissal, or removal of a particular person.
I have a question. Well, first, I would observe that since this is the only respondent, it's not, there's no reason we can't talk about it. But second, can we just ask Major Lloyd whether he feels that this needs to be in executive?
certainly. How do you feel about that? Do you want us to go into executive session, or you don't have a problem?
Last time I was here, I think we were in executive and they said it needed to be in public.
Right.
So I'm open. I think this was a response because again, last time we were in executive and a lot of the supervisors felt it should be a public discussion.
Is there anything that you feel is proprietary that would
No.
be damaging to your organization?
No, I don't think there's anything in there that we couldn't discuss in public.
Do you see any reason for not moving forward then?
if the committee
Is the
not
committee all right with
comfortable
that?
and the vendor is
Open
comfortable,
session.
and I do think, Madam Chairwoman, that perhaps Dee would be looking for a resolution out of today's discussion to go forward or not with the proposal. Is that correct?
Right, if the committee decided to
feels-
move
okay.
forward with it, yes.
All right, let's start with Mr. McDevitt, then I will
No.
ask the major. if he might have-
As Major, first of all, this
Use the podium.
Get right up to there to the
Yeah,
podium.
right
there,
there, that's
Major.
good, thank you.
Major, it goes without saying that the Salvation Army does worldwide good. Okay, they're, and I commend you for what you do. You so in the Glens Falls area. I'm a guy that lives alone. I live in Glens Falls, and I think I get around a bit and am reasonably perceptive in terms of what's going on. I need to be convinced that there is a compelling need for what you're proposing here. I am not convinced at this point, okay? I don't sense that to be the case, that there are a lot of folks out there that are, granted, we have poverty in our society, but I do not believe that there's a large segment of our population that's going hungry on a daily basis, okay? So I need to be convinced that when county funds ultimately are going to be spent, when you're considering the purchase at, I'll throw a number out there because it, of $1 million for an additional piece of property, that the monies are spent efficiently. But more importantly, I am not convinced that there is a compelling need for what you're proposing. Help me with that.
So I think there's some confusion. we made a proposal in an executive committee some time back. It was in the spring. What I'm here to speak about today is an RFP that was put out by the county, and I was asked to respond to it. I just found out being here today that I was the only respondent. I didn't know that. I would imagine that there would have been lots of people responding to this RFP. And I think there's some confusion, Supervisor, with a previous proposal I met and what is being discussed today for this RFP. For this RFP, what we were asked to bid on is especially for seniors meals program. Now, my understanding is that's a well-established senior citizens Meals on Wheels program. My understanding also is that it's the largest portion of the meals in the county area or in the two-county area. It's concentrated around Glens Falls and Queensbury, the majority of the meals. It's somewhere about 55 to 75,000 meals a year. And what we proposed with this RFP was that we would do this Meals on Wheels program at the Salvation Army building in Glens Falls. We're not looking at purchasing another building. We have a commercial kitchen there. And that we would use other county contracts to make this more attractive to the Salvation Army, frankly, and to, kill a couple of birds with one stone. So the county already has a well-established Meals on Wheels program that they would like to move from Cedars to another location. So we're proposing to use our location here in Glens Falls. The only money that we asked for was some ARPA money to beef up our equipment. So we would need a blast cooler and a combi oven. Most of the other stuff we have in place, the blast cooler and the combi oven, it's about $100,000 ask. And we thought we would make that request to the county for ARPA funds. And again, this program would just take the place of the Cedars. We have a beautiful facility. We already have senior programs happening at the Salvation Army. We could wrap services around seniors. The Salvation Army is also well equipped to do home deliveries. Again, well-established flag. We did home deliveries all during COVID. We've done home visitation and deliveries for you. In fact, the Salvation Army has, and my understanding is the spirit of Meals on Wheels, especially for home delivery, is a home visit. We have a ministry that's nationally recognized where we vet volunteers to just visit senior citizens in their homes and in nursing homes. So I think that, maybe there's some confusion. We're not looking for $1 million where we submitted what our cost would be to provide the meals delivered. We included in the proposal that if they wanted to do on-site meals at Cedars rather, have that continue to be a service location, that we would deliver those meals to Cedars cater style. So we deliver them hot so that there would be more services in Glens Falls, not less. The other thing that we talked about was there were several locations that were closed in Glens Falls because of COVID. And we talked about, again, the ability to reopen those locations because we could deliver the food to those locations hot and ready to be served. So we would still be able to serve Cedars. We would be able to help open the other two locations. We'd be able to take over the Meals on Wheels program for Lake George. And we'd be able to open a new location at the Salvation Army where people could come in and see and wrap services around those seniors. So I think maybe you were thinking of, a proposal that we did in the spring. This is an abbreviated proposal, but it still marries workforce development. So we have contracts with County Social Service Office now for folks who are receiving benefits, but who are able-bodied. They can go back to work, TANF benefits and SNAP benefits. And we're working with the Social Service Office here in the county, Employment and Training here in the county, And I think the beautiful thing about bringing this meals program to the Salvation Army is that a portion of the people who would work there would be these folks who we're talking about in the workforce development program. This would be a bookended job for them. We get them 90 days working in the Meals on Wheels kitchen, and then give them warm handoff, to somebody else in the community. So, I mean, that's the proposal in a nutshell. Does that answer your question?
Yes and no. Let me back up just a little bit here. The meals would be prepared on Broad Street in
Yes, sir.
your location. Have you gone to the city of Glens Falls, to our local officials, and attempted to get an approval in terms of what it is you're proposing to do?
Our kitchen and our building is inspected regularly by the city of Glens Falls, and I don't anticipate any problem doing this. We have walk-in coolers on site. We do meals on site now, and we haven't had any problem.
There is a letter from the mayor as well.
I was just,
Yeah, if I might be able to help Supervisor McDevitt here, as part of what was submitted from Glens Falls, New York, August 17th, to Julie Butler, purchasing agent. From dear Ms. Butler, as mayor of the city of Glens Falls, I'm pleased to support the Salvation Army's proposed senior
Yes,
meals
okay.
program, and has a whole letter in.
I have a question. Do you mind?
yes, Supervisor Hogan.
Is what you're proposing to do a change of use in that building that would require planning board?
No, I don't believe so.
And we did receive letters though from the Great Escape, the Aviation Mall manager, from Jeff Mead, the general manager of Cool, Adirondack Chamber of Commerce, from the mayor of Glens Falls, who are all saying they thought it was a great idea. They thought it would be a good thing if the Salvation could work in that manner. So, we do have these other organizations saying.
So some of the letters I support are for our workforce development program. We've been working hard to get folks that can be working back to work. And so Great Escape, the Cooler Shore and Arena, Aviation Mall, they're supporting our workforce development program. The Adirondack Chamber of Commerce and the Lake George Chamber of Commerce is, we have employers that will say, listen, if you can get these folks a good start, we'll give them a shot. And so that's where you get some of those letters. Mayor of Glens Falls likes the idea of us being able to do a senior citizens program at our building. We just did about $100,000 renovation in our gymatorium. That's where the meals would take place. We can seat in there about 300 people. But we also have great senior programs to wrap around, and we're right downtown. So we have senior sewing programs that are happening in the building. We have social work that can wrap services around. We just started pickleball this year, and dance. So the idea isn't just Meals on Wheels, but it's combining, wraparound services for seniors. It's also taking the expertise of the Salvation Army when it comes to in-home visits and doing food service. I mean, the Salvation Army is the largest provider of housing and meals in the United States, with the exception of the United States government. What you should also know is that before I could even make this presentation, I had to go through a pretty heavy vetting process with the Salvation Army. And I had to go before what they call a Mission Alignments Council. Anytime you're going to do a new program, and they're pretty thorough as far as what does the budget look like? Do you have the capacity of, these questions? And so I do have the full support of the greater Salvation Army to be here today and to develop this program.
I'd like to go back to D for just a minute. I wondered if maybe you could give us what you feel are the benefits of the Salvation Army working with this on, because I know you had a few listed here for me, but you might want to bring them to the committee's attention.
So what we felt the benefits were, and we're okay with either staying the way it is or going with the Salvation Army, was having a congregate location that is open up to everybody, because currently right now Cedars, they only allow Cedars residents to go to their site. there is the possibility that they can deliver 5 days a week, where we haven't been able to go back to that because we don't have the volunteer base. The big one is delivering meals to that Lake George route, because they're still getting mom's meals. We don't have a driver to deliver to them right now. We've got somebody that might be able to do Mondays and Wednesdays, but not Fridays. He just mentioned this. It wasn't anything that we had in the notes, was that the social aspect. They have programs that they're offering the seniors that we don't have at the congregate location, and definitely at Cedars. Like I said, it's only open to Cedars clients, the Cedars residents. So it's not anything that the other residents of Glens Falls or Queensby are getting access to, where they could at the Salvation Army. And then I think for future, it's that there could be a cost savings because they have access to more vendors than we do. We do the bid process where we have to go with the lowest vendor. So sometimes we get a lot of complaints about the quality of the food. They say that it comes from certain places where it doesn't, but they can have multiple vendors. They can have access to the fresh markets during the summer. So fresh produce, fresh vegetables, things like that, where we don't always get that. So there's a lot more that I think they would be able to do than what we can do with what we offer.
Thank you, Supervisor Hogan.
Thank you. So many questions.
Yeah, I get a ton of-
Backing up to Cedars, so they never went back to welcoming people from outside of Cedars after the.
They never did it in the first place. The Cedars location is only open to Cedars residents. It's always been that way, yes.
There were 2 other locations
We
in
had,
town
yeah,
that used to have folks. They have not reopened.
and
again,
that's
as part of the
Solomon Heights and
proposal, we
First
talked
Presbyterian.
about if it was
We don't staff.
preparing the food that was stopping them from reopening, we could deliver, cater style to those locations so that they could reopen, which hopefully would open up not just those 2 locations, but more locations might be willing if it was just a service. And so, that would be the dream, wouldn't it be? So in every little neighborhood, if we could deliver catered meals there, you could have a nice little senior citizens group that met there for fellowship, but they wouldn't have to have the requirements of, food preparation, just service.
So a couple quick questions. What are we currently?
It varies. So overall for Warren County, our average cost per meal is close to between $9.50 to $10 a meal.
So this proposal was right on the mark.
Yeah.
In terms of that.
Mhm.
In your proposal, you mentioned $2.50 for delivery to Lake George per mile.
Could you speak up?
Speak-
Amy, so we can
Right.
hear?
Not
We
us
can't
can
hear.
hear.
In your proposal, you're mentioning $2.50 per mile. Is that per meal per mile?
It depends. I think there was 2 different, I don't remember off the top of my head, but I think there was 2 different mileage.
So I believe it,
requirements. One, if it's going to individual homes, I think you pay a volunteer, whatever the IRS mileage is. The other one is if I'm delivering to, via truck, hot mail to a catered site, I think that was the $2.50 a mile. If I have to take a box truck with heated,
But is that per meal per mile?
no,
Just $2.50 flat rate?
right.
Okay. And I have to
But
tell you,
there's 2 different mileage requirements.
Right, I
One's
saw that.
to go to individual houses.
right.
And I believe that just follows reimbursement for IRS personal vehicle miles. And I think that's in there. The other one is if I have to take my truck, fill it full of meals, and go to a location. That's $2.50.
I just wanted to make sure it wasn't per meal per mile. Things that I loved about your proposal are the workforce engagement. That's fabulous. If you could also be looking at our senior population as potential for re-engagement, I think that's something we've heard from Liza, that we've lost a lot of people from retirees that could potentially come back and help out. That would be great. I have been probably the most vocal opponent of outsourcing this kind of thing, but I think your proposal is really solid and I'm supportive. So thank you for bringing it.
Supervisor Beatty, your thoughts?
Yeah, I've got a lot of questions. I don't know where to begin. First of all, I didn't know we had, I think we all agreed we wanted to get 5 days a week hot meals. And wasn't a critical need to change locations to make those meals. There was a need to get people to deliver the hot meals. So I think this is going way beyond what I think our need was, what we were asking. Whether that's good or bad, I don't know, but, so if you could fulfill the need to deliver 5 days a week with our current Wheels on Meals volunteers, to me, that's the ideal situation. Okay, so do you, first of all, do you have the means to supplement our current workforce of volunteers that deliver Meals on Wheels so that we could get to a 5-day-a-week hot meals delivery?
So the Salvation Army has a program called League of Mercy that, and all they do is visit senior citizens. It's not large now because we haven't had the requirements, you know, but it's something that we would ramp up. So we would take whoever the county volunteers are now, we would put them through our vetting process if we got this contract, and then we would increase that. But if you're asking me, well, I don't know if you're asking me, would I just do?
Well,
Can I just coordinate delivery volunteers for you?
yeah, I'm asking you if you can supply some of the manpower, because you've got people that would like to work and so forth. Can you supplement what we have already, is what I'm asking, so that we could get the 5 days of meals, 5 days a week. hot meals?
Well, I'd have to, I'm not prepared to answer that. I'm not trying to dodge the question.
No,
because I
I'm
don't
sure.
know what your needs are, what it would. My understanding was, from the county perspective, because again, the county approached me, I didn't go looking at it.
I think that's where the disconnect
Yeah.
is. We didn't have this need, at least.
So
we in the community.
about moving out of Cedars because it wasn't optimal.
There was never a discussion, I know, of moving out of Cedars. This is the first I'm hearing of this. So
Well,
that's why I'm caught off guard.
that's why the first RFP came my way a year ago. That's why the second RFP came my way. And again, it wasn't something that I went looking for. The county approached me and said that we would like to move this program out of Cedars for a number of reasons. What do you think about it? I said, well, I think we could do a great job with it.
I'm on the committee. I've never saw that. I know Ms. Kramer never saw it. She's on the committee. So that's where the disconnect is happening here. I mean, this is all foreign to me. I know we've had a crucial need to get 5 days a week hot meals. I don't want to reinvent the wheel, nothing against you guys, but if you can help us do that, I'm 1000% for that.
Again, I would have to look at what are you specifically asking.
Well, I can't be any clearer than that, but I know you'd have to do it logistically, figure it out. If we are short people to deliver wheels or meals, I'm asking, would you have the manpower to supplement that? That's all.
Supervisor Geraci?
I think the issue is much broader than that, though. I thought there was also an issue of preparation, and preparation is not an issue. Maybe I misunderstood, but I thought that was part of the issue for 5 days a week. For a couple days a week, it might not be. And then the broader programs that they're offering, as you heard, right now, it's very limited if you're a resident there. So I think this is, I'm not sure what that means. Well, we heard about all these programs that are also would be available at the location of Glens Falls compared to what's available now. So it's much more than just delivery of meals.
Supervisor Hogan, I saw your hand.
Thank you. I think the issuance of the RFP was our way of saying that there is this need.
For 5 days a week hot meals.
Well, for some sort of help getting meals to seniors. I agree with you very much that we need to get back to 5 days. I think this is a step in the right direction because what we've been hearing consistently from the OFAs is that they're having trouble meeting this need. So I agree we need to keep pushing for 5 days a week, but I think the issuance of the RFP was our way of saying there is a need here. My question though for you was, are you going to be able to honor this proposal if you don't get ARPA funds?
I have to go back to the Salvation Army and request $100,000 to spend.
So is it in there that it's contingent on ARPA?
Please speak into the microphone.
I'm sorry, is it in the proposal that it's
I don't
contingent?
know that I made it contingent. I asked.
Thank you.
Supervisor McDevitt.
I'm just trying to clarify. So are you, currently, are you saying you are prepared to provide meals how many days a week?
5 days a week.
5 days a week. Okay, so it is 5 days a week. So the question is more.
That's what the RFP asked for.
Okay, so if there is an issue or a problem, it's really the delivery of those meals 5 days a week. Is that a problem?
Is it a problem for me or you?
That means-
I guess if it's a problem for you, it becomes a problem for us and
Right,
vice
well,
versa.
I answered the proposal because I believe that we can fulfill the mission. Otherwise, I wouldn't have answered the proposal.
So the answer is yes, you can deliver
Yes.
5 days a week. It may cost a couple of nickels here and there, but you have the ability, you feel, to provide that service.
Yes.
Thank you.
Supervisor Bramer.
I have to admit, I am confused because I did see your email over the weekend or Friday about, looking at the proposal and I thought, okay, well, I've looked at their proposal, but that was the one from spring.
Right.
So I didn't know there was another one dated August 7th, and maybe I just missed that in my email or something, but I would like time to go back and look at it and understand what the costs are. They're offering 5 days a week hot meals delivered to all our existing.
No, just to the 3, 4.
Queensberry, Lake George, and then, Queensberry, Glens Falls, and then the Lake George route, with the possibility to extend to others in the future if needed.
Okay. So I guess one of the things that I was concerned about was
Are we going to?
and you mentioned it, First
don't have
Pres
the
is in my
volunteer days.
ward, and
Here.
I don't know if they've been asked if they can reopen and make a congregate site there, but it does sound like you would be willing to offer congregate sites in each little neighborhood, which I think is great. I'm not sure.
That's catered deliver, we would deliver the food cater style. And they would need, a hot plate, to do that.
So that's like family style where they would serve it out of a serving dish, not individual plates.
Right.
So do we still need to have a county employee standing there monitoring it? Because I understand that's what we do now, which is why they're not open.
They are taking over it. Right now, we don't have the staffing to do the congregate setting portion in the sites where the congregate sites are not open.
Why is that? What's the underlying problem for that?
Why we don't have the staffing?
Yeah.
Because we don't have it. We don't know why. We did just have the price increase or the salary increase, but that just happened. We are trying to recruit staff, but we haven't gotten them in all of the sites. We still have, I think there's 5 positions that are open, and we're utilizing subs to cover them.
And so the idea with this proposal is that they would fill those positions most likely with the workforce development individuals who need some experience.
Workforce development individuals is only a handful. They would work primarily at the kitchen, not delivering meals. Delivering meals would most likely be one of my drivers.
Major,
Decided at some point.
you speak into the mic. We have this air conditioner thing going. It's hard to hear. Thank you.
What? There's only a handful of, if you understand the proposal, there's only a handful of workforce development. We're taking 1 to 2 referrals a month from the county for workforce development. So they would work in the kitchen, not delivering meals.
I guess
Can
my
I ask
question at this point is, how would the committee like to move forward? We can either
Put it on the
accept
agenda.
proposal, we can hold off until next month. Supervisor
Yeah,
Lady.
thank you. I haven't had time to look over the proposal that was sent out this weekend, so I'd like to have it put on the agenda for next month, so I have time to look over the proposal.
Can you email
Yeah.
it to us, please?
And then we can talk
Julie
about it.
asked that you stop in the office to look at it. She didn't want it emailed out.
Oh, it hasn't been
Supervisor
emailed.
Hogan.
Can we request that the proposal, since it's all out there in the open anyway, get emailed to the committee so we can
Can
have
we
it?
do that now? Do you get-
If Julie's okay with it, then yes, I will email it out.
Okay. I
Thank
think-
you.
yeah,
Wait,
they-
Tammy has,
Yes, no?
I just spoke with Julie, as long as Major Lloyd is okay, then it's okay to go out.
I didn't hear what the question was. I
We haven't
apologize.
seen your proposal because it hasn't been emailed to us, this most recent one. Is it okay if the committee members get an
Oh, of
email
course.
copy?
Flying blind here.
Thank you.
Exactly.
All right, so that's what we're planning on doing then. The committee would like to
Yes.
put this on the agenda for next month. You will get a copy of his proposal, so you all have plenty of time to look it over. I think he's done a wonderful job. I really think we should really seriously think about it because I think it will solve many of the problems that we've been having in the past, but that's going to be your decision, not mine. So do we need a motion, Mr. Conover, to like put it on the agenda for next month? No, so we'll
Just
just-
before I make that motion, I think that was a good recommendation to do that, to give people time.
Speak up.
To give people time, and I think that's a good recommendation, but I just want to say, I think the fundamental question that is being raised here is, do we continue, we being Warren County, do we continue to man and manage a meal production site at Cedars, or do we contract and the meals that provides to the broader area, or do we contract that? I think that's the fundamental question here. I mean, I think that I think there's subordinate questions, which is, do we continue to provide the meals at Cedars? Right, a lot of seniors there. There may be no reason not to continue to provide the meals there. But I think the fundamental question here is, how do we plan to do this going forward? And I think that that's the question that the RFP was aiming at trying to address. Whether it did or not, well, we can each individually evaluate that. And with that, I'll make the motion that we table this to give everybody time to think about it.
All right, second to that. Go ahead, Dee.
I just want to make one comment. This is not anything that the Office for the Aging initiated. I mean, we did ask for this last year. And Major Leo continued to move forward on it because he wanted to do something for Warren County as a whole, looking at the economic workforce development, all of that. And then brought it back up with ARPA and everything. And that's why it moved forward. It was not anything that we initiated. We weren't looking to move forward on it or anything, but I do think it is a good idea, like I said, for the workforce development, the economic development, all of that kind of stuff. But whatever the committee decides, the board decides is fine with us. But I just want to make it clear that it was not the OFA, myself, that brought this to the committee that wanted to do the RFP. We did have input on it because we had to have input on it, but we did not initiate this.
I think in the interest of the committee, we got an email, I think from Amanda, was it Friday, maybe basically, or
It was
our
from
chairman,
me, you're right.
basically saying, hey, here's
Yeah,
here-
we're
here-
gonna discuss it,
here's the
right.
deal, we're gonna talk about this. And I sent back an email saying, kind of,
You didn't have
can I
the
see
thing on,
it?
but
Can
you
I
got
see
that.
what you're talking about? Okay, so that's what we're talking about now. So
Yeah.
we have not had an opportunity to sit down quietly and.
Is that a second then, Peter, to Ron's
Sure,
motion?
yes,
Okay,
yes.
all those in
Yes.
favor?
Long-winded
Aye.
second, yes.
Okay, so,
Supervisor McGowan had his hand up.
all right, I'm sorry.
I'm sorry, point of order.
Oh, you're right.
Can't,
You're right.
I would ask that we don't allow the non-committee members to speak until privilege of the floor.
Okay. What committee member has something else to say? Supervisor.
Thank
Holt.
you. Just to be clear, though, if those other sites go to 5 days, the push is going to be on for the other ones. I understand
The major holdup
challenges.
is the Queensbury, Glens Falls area because we don't have enough drivers to do it.
Right, I know.
And if they were to go to 5 days a week, then yes, everybody else would that wanted to, yes.
Just
Yep.
heads up.
All right,
Fair.
Supervisor McGowan. She said your hand was up.
Well, thank you. Thank you, Carol. Just a simple one. If I kind of been involved with this for a while, with being that if you could just send me out a copy of that RFP too. I would like to be able to read along with the committee. It's such a big topic. I would like to have this vetted in my mind before a board meeting. So thank you. That's a possibility. Be added on to the email.
Possibility. All right, if there is no more discussion, we will end our meeting and move on to health services. Is that okay with everybody?
Thank you, Dee.
Okay, yes, I'm sorry,
If-
Major.
When you send that proposal out to the supervisors, if you would attach my email address, if you have questions, I'll send you a detailed written explanation. And that would, I think, would help streamline this process. If we ever come back together, you'll have some written response and it might be of value to you. So if you just attach my email to that, and that way we can try to maybe answer some
Okay.
of these questions via email.
We can do that. Thank you very much, Major.
Thank you,
We
Major.
appreciate your coming today, spending your time to answer our questions.
You're welcome.
Thank you.
And with the budget, if there's any further questions on the OFA budget, please feel free to reach out to me.
Thank you, Dave.
I'm a meanie.
You're a meanie. Big meanie.
Thanks.
I'm confused. I like the way Mike does it. He goes privilege of the floor, and then he calls on you, and then he closes privilege of the floor, and then he reopens.
Can I get it?
I thought it was the old thing. That's why. I
So
thought-
did I.
Well, why wouldn't you think, why wouldn't you?
That's what I thought too.
Right?
The committee never passed the thing saying we want to do a new RFP for services.
He's talking about something.
I don't remember that.
Brian just did that all on his own.
I'm trying to follow the rules. It was way back when.
Right along, Mike.
This is in response to another one. Ryan, she said Ryan did.
Morning.
Would you be more comfortable if I put my mask on? Would you be more comfortable if I put my mask on? Oh, no. I tested this morning.
No, you be you. You be you.
I did
We're,
test this
we're
morning.
still under New York State regulations.
Right, right.
Morning, guys. How are you? Thank you. Thank you very
That's
much.
just the other.
Oh, Thank you very much.
Boy, is this a short agenda. Oh, well.
Chairwoman?
How are you?
Chairwoman? Before,
Yes.
I realize you put us, I realize you put us into health services, but to back up a little, do you think you could tell the committee a little bit of the history of the RFP that was issued?
No, I think you should have asked Dee that.
Meals.
I didn't, I only knew it was going out. I knew
Meals and-
Brian kind of.
Yeah, like it.
And I think when you get the RFP.
It's actually 3 years, it's a bargain.
Take care of it.
But did they go through committee before it was issued?
No, I can share.
I know what you're doing.
It doesn't have to, I just wanted to know if I missed something.
What would be the addition
All of a sudden it was like.
It just went.
RFP.
Yeah.
Do you, Tammy, do you happen to know the date that it went?
No, in a town like yours to
Thank you. So to be clear,
There's another RFP set out, which none of us
It
knew
was
about.
before Ryan
but Edna
left.
didn't know either. So Tammy will get us some more details.
another question?
Well, honestly,
I think I framed.
No, that's what happened. That's no
It-
wonder.
it could
We all
happen.
good, so we can move on to health
It's, we don't have to
services.
accept the proposal based on it, but.
Good morning. We're all set.
You want me to start?
It can happen.
Wonder we're all looking at each other with three heads.
It was a confusing moment. I'll
Good
give you
morning,
that.
everybody. We will do the health services portion of your meeting. We had a late breaker, so we passed out our latest agenda. We only have one resolution request at this time. And we're requesting to amend our 2022 budget amendment to accept additional New York State funding for our children and youth with special health care needs grant. And Tom's here if you have any questions, but it's just basically amending our budget so that we can put the money in our budget.
And how much was that?
It's an additional $33,384 for the year. And then it went, the grant was $23,088 and it's going up to $56,472.
Okay, thank you. Supervisor Conover is making a motion to accept that, second to that, Supervisor McDevitt. Any discussion? Yes, Supervisor Hogan.
Thank you. Is this something is this just a one-off, or are they gonna do this again? Are they?
It sounded like they were gonna continue. This is where our grant is gonna be from now on. This is one of the
Sweet.
biggest thing- Yeah,
More than double?
yeah.
Nice.
Yeah. And the thing is, I just want to say that even though I'm increasing the budget now, the student grant starts October, whatever the balance is or whatever, because I have to now amend obviously next year's budget to reflect this. We just didn't have the letter for me to do it at budget time.
Any other questions? All right, let's vote on. All those in favor?
Aye.
Aye. Opposed? Carried. Thank you.
All right, and then we'll forward on to our attachments. I'll have Ton review our revenue and expenditures and also the comparison, unless you prefer us to move on due to time. Okay.
Okay, attachment one was our expenses and revenue as of September 9th. And again, we finished the July revenues. They're in there. We're gonna put our August in for the next. We are working on that right now to finalize that. Again, noticing down at the bottom, obviously the big salary difference, that we're 38.32% of our salary as of now and a budget. And last year we were at 66.88. So you can see the big difference due to obviously COVID and contact tracing and a lot of other expenses that we needed during the year last year that we don't right now use as much. Attachment number 2, again, is just our comparison between salaries and all the different departments. And again, our contractual is our preschool program. It's again, just the timing of invoices. Benefits are down because of course salaries are down. And revenues, like I said, reflect that for the home care up to July.
I'm sorry, we confused everything.
No, just, we have to catch up. Yes.
Oh, sorry.
All right, and then we have the rest of our regular attachments, so like our emergency preparedness report, rabies report. Worth mentioning, we have 2 rabies clinics coming up, one on October 15th, one on November 5th. They're both at the Queensbury Community Center from 10 to 12. And since we brought our rabies clinics back, we've had really good attendance. They've been well supported, so we're happy about that. I don't have any upcoming meetings or conferences needing approval. There were no referral or pending items. Back to privilege of the floor, I have 3 things. The first is we had a state survey. It came a couple months early, but we were as prepared as we could be. They arrived on 9/6. They stayed through 9/8. We were told it was an overall very good survey. We did have 16 findings, however, none directly affected patient care, health, or safety. There's new management over the surveyors. And so there's kind of a new trend and they're interpreting regulations a little different than they have in the past. One of the things that I found most noteworthy is all the what if policies that we are, I guess, in charge of doing at this point. For example, we don't hire home health aides. We contract out home health aid services like through Greater Adirondack. However, in the event we were to hire home health aid contracts, we would have to have a central registry procedure and a background check procedure. So even though we have no intention of hiring home health aides, we have to make policies and procedures just in case. So that was some of the flavor of what we got. So anyway, our corrective action plan has already been completed and we're ready to submit it today. The deadline is Thursday, so they were all easy things to correct. I don't know if anybody has any questions.
Questions? Sounds like it went all right, though.
You know, they have to find something and we always put our dander up when they find things because we think we're doing a good job, but you know, all of our policy, you know, everything's been corrected. A lot of it was corrected before the surveyors even left, but because it was a citation, it's a citation, it doesn't matter. The next is our attachment number 6, but I gave everybody a copy of our annual report, which is a bargain. It's actually 3 years in one because of our COVID pandemic. I want to thank our staff, which are listed in here, also our special COVID staff that came to help when we were in our crisis. They're listed in here as well. One of the new things that's on page 12 is our employment trends. I know you guys have heard us say that we have 16 vacancies and things like that, but we thought it was important to kind of give you some trends. Our therapists are in here, very appreciative of them continuing to see patients throughout the pandemic. And two other things just to bring to your attention. One is through the US Census of 2020, we anticipated, or our population is around 65,000. And on page 16, we track our births and our deaths. And we are significantly not having as many births as we have deaths. So I think we're shrinking if we're on the same trajectory, but I just thought it might be helpful for you to know that that's kind of what we're seeing. And then finally, we have a couple pages dedicated to COVID. Page 18 is kind of a timeline. Got a little chaotic and confusing, so I'm sure we've missed some things in there, but we tried to do our best. And then on page 19, it talks about how many clinics we did in 2021. If you remember, our vaccine became available in 2021 in January. January 2nd was our first clinic. And we did 462 clinics. We administered 10,000 doses, which I thought was a pretty significant number, in addition to doing our other mandatory programs that we were doing, in addition to the case investigations, contact tracing, the isolations, quarantines, testing, and everything that we were doing. So, if you have any questions as you're reviewing our annual report, feel free to reach out. But it's 3 years worth of work. The last thing that we have for discussion item is our budget, and I'm going to turn it over to Ton after I give a few highlights. Overall, I think we worked really hard on our budget to look at where we could do cuts, just anticipating the raises that the staff had and trying to kind of balance what we're required to do versus a would be nice, and looking at where our staffing is. Our focus for 2023 is going to be on rebuilding our agency. From the public health perspective, it's shifting from a population versus individual health. So like looking at how we can better serve the population, if there's a need or a gap, working with partners and shareholders to try to then provide the services to the individuals. Obviously, we're a gap filling agency. We have a family health program, and we'll still see people of high need that providers are concerned about, but we're just going to try to kind of shift and make sure services are available at a population level versus individual. Through our home care, as you know, through sitting through our committee meetings, our home care agency is shrinking, but still obviously they're serving people and a gap filler as well. And so I think the hopes of finding 9 nurses to come sit at our home care agency right now is probably an unrealistic goal. But I'm thinking we'll focus on what we have, and we will build and make sure that we have quality. Just going through this last survey provides another opportunity to focus on the basics and focus on how we can improve our agency and how we can improve the service we give, and just doing more with less. And so I think that that is a good plan. And then we also, because of the nurses shortage, despite all the attempts we've made with trying to increase the salaries and things like that, hopefully it'll come around. We need to creatively figure out ways to cover public health programs without nurses. So using our nurses as nurses, and then trying for all the paper pushing type stuff, trying to get more creative on how we're doing some of the other programs. So overall, in our preventive program, and if you guys want to look at the budget summary sheet, you can kind of follow along, and then Tom will kind of follow up behind me. Public health is predominantly funded by a state aid grant, and their initiatives are population health, which is where our goal population from the individual scenario stands. And for that, we're going to be deleting a full-time nurse position, and we're going to add 2 non-nurse positions that are lower grade, so that we're able to do that work without the nurse. And then we're going to continue funding our call-in rate, and we're going to add an on-call rate to be able to cover calls that happen over the weekends if we don't have staff to be able to do that. From health services or home care, we're going to eliminate 5 vacant nursing positions. We're also going to eliminate a part-time medical coder position and a therapy program administrator, which is a supervisor level position. And we're going to use some of that money to increase our contracts because by eliminating the medical coder, we actually had a nurse that was coding for a long time that's just retired on a per diem basis. And by eliminating the medical coder position that we've never been able to fill, by increasing the contractual piece, we're going to be using a contractor to do our coding, which we've now been doing for what, 2 years, Tom? 1 or 2 years, and that's been working very well. And certainly it's a lot cheaper to go through the contract than it is to pay a staff member to do that. So we're gonna kind of put our eggs in that basket versus keeping the 2 baskets there and trying to be a little bit more versatile. I think initially we hadn't used that coding contract, and now that we are and it's working, we feel safer getting rid of that position. In addition, with our therapy visits, we want to increase a little bit. So that's going to be $6,000 for the whole year as an impact for increasing rates for the therapy visits. And then we're going to add $4,000 to increase to cover meeting costs. Right, we predominantly meet with our therapist twice a year for like all the end services, and a lot of it's regulatory, meaning like infection control and HIPAA and all this kind of stuff. And initially it was once a year for 1 hour, then it was twice a year for an hour. Now it's almost like 6 hours a year. So to ask somebody to come in for a 3-hour meeting and only give them the $40 meeting rate is not quite fair. So we came up with like a 30-minute rate or 30-minute rate, so that they wouldn't automatically get a whole nother hour if the meeting went over significantly. So we put that money there. And then we're also looking at an electronic medical record, and we're hoping actually we have district funds to be able to put towards that. So we're hoping that that will be a no impact to the county. Our WIC program is total 0 impact because it's grant funded. So whatever we spend, we get reimbursed from the state. Our family health program, we have, with the changes of state aid looking for us to do more outreach and education, we're going to eliminate full-time community health nurse position and create a part-time position, a part-time nurse position. And then we're going to be triaging the visits, like I mentioned earlier, and doing more outreach and education with that nurse. And with the preventive program and with family health, we have a 36% state aid reimbursement that we can also apply towards our expenses. With disease control, our staffing's become very small. We're going to transfer $35,000 to our overtime and per diem budget lines. We're going to hopefully, by doing that, we'll have money for our influenza clinics, our COVID clinics, and monkeypox clinics if we need to. With our STD clinics, already the contracts are being signed. It's already been through the approval process to be able to work with Hudson Headwaters to provide us with a provider for our STD clinic. So we're not anticipating big expenses there. Health education, we have our 2 health educators that are out doing education outreach. They're doing tick-borne stuff, tobacco, vaping, substance abuse, working with mental health. They're working on our community health improvement plan right now, and our 2 focus areas identified by our stakeholder group was chronic disease and mental health education outreach. And just to note, Ben Driscoll's been sitting on that committee. So it's been good to have his experience and expertise with the community programs that he works with to be on that committee, in addition to being a supervisor. And then we're hoping to bring back our CPR classes and anticipating $4,000 in revenue for that. Early intervention, I'm really excited about. We have a children with special health care needs program manager, and I'm looking to promote that individual to an administrator to assume more administrative responsibilities to cover our anticipated surge through the pandemic. If you think of all these kids that have been born or have not gone to nursery schools, preschools, or the few that have had to learn to talk with masks on and things like that, we're anticipating like growth and developmental surge. And then also foster succession planning for our agency. A lot of our administrative staff are nearing or are already at retirement. age or eligibility. So the thought is making sure that we have people in administrative roles that have that administrative experience to be able to potentially be promoted if needed in some of our administrative positions. And in doing that, we will also be increasing a per diem service coordinator up to 30 hours a week. And then we had 3 different grants that are all zero impact to the community or to our budget, because whatever you spend is what you get reimbursed back in revenue. And those are our ComCare grant, which is continuing to cover our contact tracing, our New York State ELC school grant, which we were just able to buy air purifiers for a lot of the schools that requested them. And then we have a fellowship grant that's kind of sitting there, but we're kind of still looking at that. I, during my budget meeting, had 3 requests for future consideration should money be there, and I know money's tight. The first one is a carport for cars, and I'm not talking just for maybe health services cars, but for maybe the whole fleet of the county, in excess of the sheriff's cars, because I know they have their own carport over there. But I do think it would protect the cars. It certainly protects the staff, you know, trying to get in cars. If you think about all the cars parked in the parking lot and you're removing the snow, it kind of creates these little mounds that then staff like will try to walk on and can slide under the car or slide or slip or whatever. So if you had a carport that would prevent the snow removal, that would be good. And then also it would help buildings and grounds staff because they wouldn't have to constantly de-ice our parking lot so our nurses could get to and from the cars. Thinking proactively, you could also even think about making it to where the electric car scenario, you know, in the future, you can, you know, maybe house something like that, or make it to where it could easily be transitioned should we become all electric. Another part is just looking at our office area to just try to look at more ergonomic workstations and things like that. Now that we don't all have to have the desktop computers that are plugged into the wall, and you don't necessarily need the phones that are plugged into the wall, you know, we could probably look at our workstations and make them a little bit more usable for staff. And then, you know, I have we put in a copier for public health, but Tammy, correct me, is that through the new national contract? Okay, so I guess I can take number 3 off the list. And with that, Tom, do you want to comment on?
I can just quickly go over this long sheet that we attached all of you is a summary sheet listing all our departments. First, to bring to your attention, the 4 highlighted, our preventive program, which is including Janelle, our disease program, our preschool program, and our early intervention are all mandated programs. So I just want you to be aware of that, all expenses and revenues regarding that. Going across line by line, I don't necessarily need to, but the first peach column is the estimated payroll adjustments, which Janelle had said in our home care, because we don't expect we're going to hire 9 nurses or 12 nurses. So we are taking out 5 nursing positions and a couple other. That's an impact with fringe of $525,000. And so that tells you right there, that's a big one that we were anticipating, and we're being proactive and again, trying to keep that where we feel we need to be. I believe it is keeping 3 full-time nursing positions still in our budget. Going down, we also see the preventive program increases and decreases with, like she had just highlighted, with different positions that we're going to eliminate, make a full-time, a part-time. And the bottom line is the impact that we're anticipating with all our payroll adjustments is going to be a credit of $427,147. So that's all salary and fringe, at least what's been in the budget and how we want to impact that. Any other estimated revenues or adjustments we need to do, and then the white column, I guess I should say, after the 2 pink columns, that is what we're anticipating our bottom line with budget, 2.4 million. And you'll see the last 3 columns tells you where we adopted budget last year, amended budget, and actual budget, and of course that included some COVID stuff in the past with some. I do want to note that the last 3, like we said, the care grants, 200,000, I'm anticipating, because I don't know what we're going to spend from now to the end of the year, but I put in 200,000, and the school grant, I put in 500,000, and the fellowship program right now, 500,000, again, all is zero impact. I did just want to note too, the second line down, it says Health Services District Program. That is the balance that's out there that we got. That's $272,481 that we want to utilize those funds for the new home care medical records. They're having a lot of problems. We've been talking about it for years. When we switched over, we've been doing it for over 10+ years, but this is not working. So they've been really looking at it. They put out a bid. So we're trying to, and the one thing is these district funds are there. So I put it all in there, and we're hoping to expend it all between computers and software and whatever else we're gonna need. So we're hoping that, obviously, that's a zero impact to the county, and those are funds that are sitting out there that we can utilize. So we want to get those. I believe the contract with the current vendor ends in March of next year. And we're looking right now, because we have to get it up and running and get going, and hopefully then by January, we can start transitioning patients over. So that's pretty much what I have. I don't know if there's anything specific you want me to go over with budget.
You know, but I think Supervisor Conover has a comment or a question.
Yeah. You know, this is how I read this. Your plan is to have approximately a $12.8 million operating situation. That's the appropriation.
All our expenses at up.
Yeah.
Yes.
Against that, you're expecting to achieve 2.9 million in state revenue, 2.520 in federal revenue, and you have other revenue approximately 4.5 million for a total revenue of 9.922 million. Incredible. And then you're doing organizationally adjustments that achieve another $427,147 in savings for a total plan, expenditure plan, cost to the county of against almost a $13 million operating situation of $2.4 million, which I might add is less than the amount in the 2022 budget of $2,470,000, significantly less. And I might add is 10% less than that actually expended in 21.
One thing I just want to emphasize.
You know, I just want to say, wow.
Half
Wow.
of that bottom line, between the EI and preschool, is more than half those are mandated programs, and we only get 59.5 cents on the dollar with preschool. So you're already losing there. I budgeted here 1.2 million of that 2.4. So half of that is just preschool. We can't do anything about that. Right. And then also our early intervention, we get 49% back from the state. And again, that's cost that the county is mandated they have to do. So when you think about how much of that percentage is just those two programs alone. Yeah, we're hoping our home care, you know, the spots, that's where, and every year we've been cutting over the years, you know, with the nursing, unfortunately. And we can only take the referrals that we can take. If we have the staff, then we can only take so many. So yes, I always get every committee meeting, your revenues are down, but our expenses are down because we're not filling those positions. We can only do and try to keep it as consistent as possible.
Well, the numbers tell a story. I think they tell a terrific story. I mean, when you look at the narration behind these numbers, it's just marvelous. I might add just one other thing, that your actual of 2.407 is about half of the mandated.
Mm-hmm.
In other words, the 4.8 million mandated. And that's against almost a $13 million operation. Very good, very good.
We appreciate the hard work. Believe us. Thank you both. Anything else, Janelle?
No.
Any more questions regarding the budget from the committee members? Are we all good? Other than thank you, ladies, for a wonderful job. All right, with that, I am going to entertain a motion to adjourn.
Very good.
Supervisor Devitt, seconded by Supervisor Conover. Any discussion? All right, all those in favor?
But the other thing